start on this computer. Oh. All right. Hi and welcome. This is Vicki Draper, author, certified healer, and animal communicator, and creator of the podcast, Animal Messages, What Your Animals Want You to Know. This is episode 22, Be Your Pet's Advocate and Know Your Medical Decisions. And so I have with me Leah Houser here. She is a veterinary assistant for over 15 years and has all that experience and is a medical freedom advocate. She's part of the grassroots advocacy organization's initiatives for family health and protect the pets. So welcome, Leah. Oh.
Thank you. Thank you for having me, and thank you for having this conversation, because we're going to be talking about vaccines a bit today. So I know that's sometimes a controversial or taboo topic to discuss, but it really shouldn't be, because we all need to be able to fully understand what medicines we're taking, what medical interventions we're undergoing, and all the benefits and risks, and really understanding how they work. So that shouldn't be controversial to ask questions or discuss. So thank you for being willing to have the conversation, because some are not.
You're so welcome. It is so important because there's so much information out there. We want to get the real information, and so we as pet guardians can make the best decisions, and we just got to know all the facts. So looking forward to hearing this today. So why don't you start by explaining what medical freedom means?
Sure. I mean, really, it's ultimately about bodily autonomy. So, I mean, that's really a basic human right, where we all have the right to choose what goes into our body, what we eat, what medicines we take, what medical interventions we choose for ourselves. That needs to be our decision, with no consequences to that decision, no threat of loss of any kind of benefit, no threat of no employment if you don't do this or that, or denial of medical care, which is something that happens and something that we're going to talk about today too. So that's really what defending medical freedom is about, and really is just protecting your own right to choose what medical care you want to seek, what you do or don't want to do, and you know, allowing that to be in place. And really, it's just about informed medical consent, fully understanding the risks and benefits, and really understanding what you're agreeing to if you do choose any type of drug or medical intervention. So a big part of medical freedom, and really what we call the medical freedom movement in the United States as well, is vaccine risk awareness. A lot of the medical freedom advocates in the US and worldwide, really, most people get into advocacy of vaccine risk awareness because they learned the hard way, and they vaccinated themselves or their children or their pets, and unfortunately suffered a catastrophic reaction, or a lifelong disability, so, or death. That as well is unfortunately a possibility. So, you know, it's not so much being against vaccines by any means, and it's not trying to convince other people that they shouldn't do anything. It's fully understanding the choices that you're making for yourself and being comfortable with those choices. And how I got involved in this was basically, you know, I started researching a lot of medical stuff when I was pregnant with my first child, you know, doing research for my own decisions for childbirth as well as pediatric care. And so that led to quite a lot of research and interest in the topic. And then when my son was a baby, shortly after that following year, some legislation came up in Washington state to remove the philosophical exemption for vaccines for school entry. And so that's how I got involved in advocacy and sort of activism for that. So in Washington, you're required to be vaccinated to go to school, but there are exemptions in Washington state. Most states have some type of exemption. In Washington, we have a philosophical exemption, a religious exemption, and a medical exemption. And so that back in 2015, that was an attempt to remove all philosophical exemptions for all vaccines. Unfortunately, it did not pass. There was enough, public outcry that it didn't have the support and the bill did not pass. But then that led me to, continue work doing that to make sure that those laws didn't change any further than that. So myself and some other advocates, I was one of the founding board members of an organization called Informed Choice Washington. Was with them for several years, and it was they are still an active organization, and they do really great work. And now I have, started a newer organization with some friends of mine called Initiatives for Family Health, and still definitely medical freedom related, but we expand beyond the vaccine topic, where we are advocating for education on any kind of assault to our health, whether it's air pollution, EMF and radiation from 5G and cell phones, genetically modified foods, pesticides and herbicide use in our communities, things like that. And really also empowering individuals to become advocates themselves. And, it really takes all of us to make change. And, people sometimes need some resources and community to be able to move forward with that. Let's see here. I made myself some notes so I didn't get off track.
I know, because there's a rich topic and lots to cover in a short time.
Yeah. So then, because I work in veterinary field, all of that vaccine research that I had done led me to want to learn more about the vaccines that we used in our practice as well, so that I could fully understand what we were doing, what we were injecting. And if clients asked, then I would be able to give them more information. And it's a lot harder to research veterinary vaccines. They're regulated differently. Instead of being FDA regulated, they're regulated by the USDA. And because of that, it means they don't have to tell you as much information about the product. So I'll just give you a quick example. One of the best research options, if you're looking into a drug or a medical device or intervention, is reading the package insert, which is basically an FDA document that discusses every possible benefits. A lot of clinical trial information is documented there. So in the veterinary world, I just grabbed our rabies vaccine package insert. This is it. Okay. It's the card that comes with the vaccine tray, and you can't really see the wording here, but half of this is in French. So really, it's only this little bit of information. And then today I printed out a human rabies vaccine package insert, and it is a 15-page PDF document. And actually, I think they do update them. I think it used to be even more pages than that. So if you're curious about rabies vaccines, that is actually a good package insert to read, because it'll give you a lot more information about possible side effects and whatnot than the veterinary one will. They are not the same formula by any means, but still, it gives you a little bit more information than what you would get otherwise. And then based on, my legislative experience in dealing with trying to get bills passed and, meeting with legislators, I decided I wanted to try to change our state rabies law, mostly because we really have started seeing a trend in the last few years that veterinarians are denying care or withholding medication refills or services if people don't follow the law and vaccinate for rabies. And most of this is people with either dogs or cats that are elderly, have been routinely vaccinated in the past, more than likely still have protection. And I've seen everything from 19-year-old indoor only cat who they refused to refill her steroids that she needed for her autoimmune condition unless they vaccinated. I've also had people tell me that their vet, they asked to do a titer. The vet said, no, you can't. It doesn't matter. You have to vaccinate. It's the law. That is not our state law, with veterinarians strong arming you into giving your pet an injection that they may not need. Our state law is really very simple. It basically just states that the rabies vaccine is required as per manufacturer instructions. So it specifies that it's an every 3-year interval. That's what the manufacturer data says. That's it. That's all it says. It's required. And then there's various city or county ordinances, but they typically say the exact same thing. Simply stated, just rabies vaccines are required. So what I wanted to do in changing the law is allow for titers to be an equivalent of your proof of vaccination. So it's very well acknowledged in scientific literature that rabies vaccines in dogs and cats last far longer than that 3-year duration. There's been even more intensive recent studies done to try to extend mandates, basically lengthen the amount of time. That was called a study called Rabies Challenge Fund. And if you go to that website, you can read a little bit more about it. But they were able to prove that across all breeds of dogs, a 5-year duration of immunity from a single dose. They tried to get 7-year, but I think they were unable to prove that with all breeds of dogs. So for many dogs, especially smaller breed dogs, it lasts far longer than 7, if not 10 years, and perhaps lifetime for a single dose. And if your pet has already got rabies antibodies from a previous vaccine, I mean, developing that antibody is the goal of that vaccination. You have achieved what the vaccine is supposed to do. So there is no benefit or really any cause to give another dose if you've already met that sort of threshold of protection. And also titers are used as well for entry into other countries and states as well, to sort of assure that the pet is protected for rabies. And as well, there's a lot of the clinical data studying that duration of immunity. They really have proved that those antibodies, when it comes to rabies and rabies vaccines in pets, those antibodies do translate to real world immunity protection against the rabies virus. So, there's some question about like, oh, well, you can't use a titer to tell you if it's really, but in this case you can, because they have done enough study with challenge studies where they purposely expose dogs to rabies to see what happens.
Okay, so briefly explain titer for those that might not know, because it's
Sure.
Yeah.
Yeah. So an antibody titer is basically a blood test where they are measuring the circulating antibodies or, virus or bacteria. So there's a couple different types of titers where it'll sort of just give you a positive, negative. And then there's what they call quantitative, where they give you an actual number. So usually the minimum level that they want, like if you're going to be going to Hawaii with your pet or moving to Hawaii, and some countries abroad, they give you like a 0.5 per unit. That's the minimum antibody level that they want to see. And so it's useful to get that actual number, because that'll help you decide how long it needs to be before you even need to look at it again. I mean, we've seen small dogs that have a level 14 units, not 0.5, but it's 14. Like those individuals are not going to even need to have their antibodies looked at again for several years, because it's going to take long time for them to wane all the way down. In addition to that, it's important to realize that the lasting protection and how long it takes before your antibodies drop off, that is a very individual thing, and there are a lot of factors that can affect how good your immune response is to a vaccine and how long that immunity lasts. A lot of things can affect it, even outside exposures. So like if you're on an immunosuppressive medication, that can make your antibodies wane more quickly. Waning means that they're falling off and sort of dropping away. As well as other, medical conditions. It depends on sometimes, how healthy you were when you got vaccinated can affect how well you respond. Age, breed, size, a lot of these things can affect how high your antibody level goes after vaccination and how long it stays that way.
Yeah, and so that's why clearly a blood test is so much safer, and if they already are protected, than having another injection. I mean, and especially with some of those numbers that you're saying are really high, that they are
Right.
protected. So thank you for explaining that.
Yeah.
And so what next would you like to share with people? Is there something with the legislative effort?
Sure. Well, going back to that legislative effort. So we did get a bill introduced. It was actually in the 2019 legislative session. It was House Bill 1741, which basically just stated a positive rabies antibody titer equates to your proof of vaccination statewide for any type of recommendation or requirement. That bill unfortunately didn't really move. So at this point, the bill's done. Nothing happened with it, unfortunately. We're in the process of trying to get it reintroduced for this legislative session. Even if we don't, though, or even if we do and it doesn't pass, sort of what I wanted to convey today was just what you can do with this information now, regardless of what the law says. So, I mean, first off, we talked about the laws just very simply stated. Veterinarians are not bound to force their clients to do it. Veterinarians are not required to enforce. So any attempt at that, I mean, we have people who say, yeah, they won't spay my dog unless we do the rabies vaccine. That is not informed consent. That is a coercive way to get you to say yes. You shouldn't need to do that. If your vet is wanting to do that, you should find a new vet, because there are plenty out there that will not do that to you. So one, for sure. I mean, if you know that your dog is protected already and they don't need it, then you don't want to just say yes to that. And especially if your pet had a bad reaction to rabies in the past, we don't exactly have medical exemption availability in the state of Washington for pet rabies vaccines, but your vet can still write an exemption for that. If they feel that this is going to harm your animal, there are still ways to sort of get around that. There's definitely, in the eyes of the law, it can get complicated only when the main situation that's an issue is if your dog were to bite someone and they are not current on their rabies vaccination. That, and if you're going to travel outside the country with your dog, you kind of can't get around the every 3-year vaccine. But if you just need it for pet licensing, they will usually accept your titer results or an exemption letter from your doctor. Or if you just need to show proof for like grooming or a kennel that your dog has to go to, talk to the owners and, talk to the groomer. That most places will accept a titer. If they don't know what it is, then you can educate them about what it means. But really, a titer is better assurance that the dog is protected from rabies than just the vaccine is, because it is possible, some animals are non-responders, and this is the case with people too, where they don't mount an immune response to the vaccine. So you can give it every 3 years as much as you want. That's not going to change the fact that they aren't protected. So really checking titers after that 3-year expiration, we're really getting better assurance that pets are more protected, and us too, because that is the main reason that this law is in place, is to reduce rabies in pets so that people are less exposed to rabies.
Yes. So it sounds like this is controversial.
Yeah. So,
And so there may be vets that don't do titers. And so to
right.
know that it exists and you have the ability to then visit a vet that does do titering and get those results,
Mm-hmm.
would be a way to empower you and your pet.
Yeah. And actually I'll bring up Protect the Pets a little bit here too, because if your vet doesn't want to do the titer, or you're having trouble, finding a vet that will, Protect the Pets is a national sort of grassroots organization for this very cause, for basically allowing for rabies titering and titers in general, to avoid over vaccination in pets. So it was sort of started by a veterinarian named Dr. John Robb, ROBB. And he actually, if you go to protectthepets.com, it may be .org, I think it's .com, you can actually have your vet just draw a blood sample and you can send it to Dr. Robb, and they will do the titer for you and explain your dog's titer results, and even write a letter that explains what the titer means if you need a letter or some kind of documentation for your whatever facility you're needing to show proof for. And so Protect the Pets has sort of branches throughout the country, where there are a lot of states that are trying to get this type of legislation passed. I know there's a bill in Arizona. They were actually able to pass a bill in Delaware last year, I believe. But there's also been attempts in other states that have not made it through. I think they got really close in New Hampshire a couple of years ago, and it unfortunately did not pass. So still just a continued effort to sort of advocate for this cause, and really doing the best we can to protect our pets' health. And really it's about educating people as well on their choices and what's best for their pets.
Yeah.
So yeah, I mean, I think the main takeaway that I want people to know is that you're not bound to the law. It is really ultimately your decision if you choose to give your pet this vaccine or not. Whether or not you're comfortable with not complying with the law, and I'm not saying you just shouldn't, but when your dog is already protected, you are following the law. You shouldn't need to do something completely medically unnecessary. Your pet's already protected. So sometimes we need to push back a little bit and just do what we need to do to be an advocate for our own pet and protect them.
Yeah. It didn't pass before. This is one of those that the more understanding and the more awareness that
Right.
good chance it will in the future. It's just not now. And so it sounds like you gave your last, or a takeaway. I was going to ask if there was any last thing you wanted to say before I let people know how they can get in touch with you. Was there anything else?
I don't think so. I mean, we have, there are Protect the Pets Facebook pages that you can follow. There's a Protect the Pets Washington page, which is a really good one to follow as well. And really just, reach out if you need more information, or if you're having trouble finding information. Other pet owners can be a really good resource as well. But yeah, there are definitely ways to get more information, even if it's just reaching out to your friends for a different groomer to go to, or a different kennel that isn't willing to work with you, things like that. So.
Right. And so for those of you interested in getting in touch with Leah or finding out more information, you can visit initiativesforfamilyhealth.org. it has information and resources, and you can email Leah directly with questions or needs resources at Leah, Leah, at initiativesforfamilyhealth.org. And you can follow Initiatives for Family Health, Protect the Pets, and Protect the Pets of Washington on Facebook.
Mhm.
And I will put all of this in the comment field, so you'll have a visual and a link to click on when we are done with the Facebook Live. And
Perfect.
yeah, so thank you so much, Leah, for being here with us, because I, like you, did the same thing when I had my daughter and was researching all the vaccinations at the human level, and then and absolutely on board with following it for the pet level, because I've seen, like you, way too many mishaps with overvaccination, and it's sad. So, and we don't have to go through that as a pet guardian, and so so thank you so much for being here today and sharing this important message and information.
Thank you, Vicki. And yeah, I would just say one more time, if anyone has any questions or needs resources on the human side of vaccines as well, or any of the other topics that Initiatives encompasses that we talked about at the beginning, please feel free to email me, and I will help however I can do that.
Yes, great. All right. So thank you again. And this is Vicki Draper, author, certified healer, and animal communicator with healingyouranimal.com and Animal Messages, What Your Animals Want You to Know podcast. And we will see you next time.